We've had confirmation out of Victoria, Jared. Once again, now the Delta strain has come out of hotel quarantine. It highlights it's not a perfect system. Should the federal government be a bit more proactive around finding more sites rather than sitting back and saying states come to us with possibilities?
I think the federal government has been very proactive. This year in Australia, we've had actually no deaths at all from COVID in Australia from those people who've got COVID. Contacted COVID in the community. We've also got Howard Springs facility up in the Northern Territory. We've just committed to another 500-bed quarantine facility in Victoria. And we've offered billions of dollars in support to the states in medical services. And you have to remember, Tom, that we don't run the hospitals or the health systems or the police systems. So I think the federal government's done a very good job in keeping quarantine very low, outbreaks very low. We've had 360,000 people go through quarantine. 4,000 of them have tested positive, and of that, only 6 have actually got out into the community, 2 of which were in New South Wales, who didn't have to close down at all, 2 in Queensland, 1 in Western Australia and 1 in Victoria.
The number of total leaks is more in the low 20s, isn't it, that have resulted in leaks, whether they've got out into the community or not. It's the virus getting out.
Well, that's right. There's been, I didn't know there was 20. I thought there was 6, 2 in New South Wales, 2 in Queensland, 1 each in Victoria and Western Australia. But the point is that they have been contained, and we have to learn to live with COVID.
Well, we had one from South Australia, though.
Perfect.
I mean, just on the face of it, those figures can't be right. What about the South Australian quarantine leak that ended up in?
Well, I thought that was that proved to be a false case. My understanding was that was a false case, and was that wasn't necessarily out of South Australia. Or the one I'm counting from Victoria was the one from South Australia. But effectively,
South Australian hotel quarantine. It wasn't false. That was a South Australian man in quarantine in South Australia that ended up taking the virus to Victoria.
Yeah. Okay. Well. Okay. But give or take a couple of numbers. The point is that we have to learn to live with COVID. And we can't lock down every time there's an outbreak, Tom. No system is fail-safe. No system is perfect. And what we need to rely on, as I've said the whole time, is our contact tracing and testing. All
right. Graham, no Toowoomba quarantine site. We've finally got the reasons why on Friday. So the Queensland government can, from now, figure out its locations. Victoria did that. It got the green light. The federal government's open to this. Are you hoping the Queensland government goes down the same path?
Very much so. I always thought the Toowoomba Airport option, because of that proximity to an international airport, good hospital system, and out of the centre of the city, made it a much more realistic option. So I'm hoping that Queensland can get on board with this, working with the Commonwealth rather than that cheap political point scoring. Unlike Jared, I don't think that whether or not people die should be the KPI for whether the Commonwealth is doing quarantine successfully. Getting the vaccination right is something that we need to do. That's been a very, very tardy response from the Commonwealth government. But getting quarantine right, as the Constitution says, is something that the Commonwealth should have stepped up during a pandemic. We're on, getting close to a year and a half since this COVID pandemic swept across the globe. That's surely where an active government would step up and say, what do we need to do? I do commend the hotels for doing the best with the resources that they have, and they're doing good things, but 21 plus breakouts in the middle of our cities is not acceptable.
All right. Graham, let me ask you this about the vaccine element, which Labor's also spoken about. The Queensland Premier, Anastasia Palaszczuk, the reasons have been shifting on her getting the vaccine. She eventually got Pfizer. That had to be delayed apparently because of tetanus and a dog bite and then a flu shot. Right at the start of this, though, Scott Morrison got vaccinated, so did Anthony Albanese, as frontline workers, as people that travel all around, and the Premier didn't. Was that a bad call?
Look, I must admit, Tom, I haven't closely followed the personal health choices of Anastasia Palaszczuk. I don't know her individual circumstances. I know her age and the availability of vaccines generally. And she's certainly been a part of, with Dr Janet Young, keeping Queenslanders safe in all that she can. Those individual health decisions can sometimes be complicated. I don't know those, Tom, and I don't think it'd be fair to me to comment on those. But she's certainly getting a good message out there to vaccinate.
At the start of it, Graham, at the start of it, she said, I don't want to skip the queue. But that wasn't what that was about. No one was seeing Anthony Albanese as skipping the queue or Scott Morrison. They were setting an example. There were people that were meeting a lot of people out there. They didn't want to spread it. Surely the best vaccine confidence message at that time would have been to get vaccinated.
Well, look, it's certainly, showing people what you do is always a good example. But look, there are people in the coalition who've made individual decisions about, not getting vaccinated. People have been promulgating bad messages. We need the public message to be clear, precise. That's why, with a Labor government, we'd be pumping money into public advertising to give good messages to people about vaccinating, because the health response is what will make sure the economic uptake in Australia flows wider, and the benefits of that can be reaped by all Australians, because we've got to get that vaccination rollout faster, better.
What did you make of the Premier's various lines on this, Jared?
Oh, look, they were mixed signals, but Tom, I'm not going to dictate people's personal health choices about taking the vaccine. You know that. We've had this discussion before. What I would like to know from the leadership is, if people do get vaccinated, will states then commit to keeping their borders open, or will they, and likewise, will they commit to not locking down? I mean, the question is, and we heard this in estimates, that people are going to need booster shots. We're not sure of how effective it is in stopping transmission, and we don't know how long the vaccines work. So what I would like to see from the Premiers is a roadmap out of here on the assumption that people did get vaccinated.
Wouldn't it go to the federal government too? Roadmap.
Well, I mean, the federal government, I'm sure, would love to have a greater say in this, but ultimately, we aren't going to. We're driven by the decisions of the states. I mean, I'm not happy about that, but that's the way it works. So we can't stop states from locking down. We can't stop states from quarantining.
There's plenty of people suggesting that you could, override the state, Pat.
Well, look, I mean, we could take it back to the High Court again, I guess. I mean, Clive Palmer took it there last year and lost. I was a bit surprised about the decision personally, but I personally would like us to take it to the High Court and just see if we can stop borders from being closed. But look, I don't want to get in an argument about constitutional responsibilities here, but we need a roadmap, and regardless, and I'm happy to put all governments, we need a roadmap out of here on the condition that people got vaccinated, or otherwise we'll be getting vaccinated, locked down, quarantined, whatever, forever. We need a way out.